Hello everyone. Welcome back to Dental Prep Pockets. Hope you all are doing very well. Have you ever been told by your dentist that you need a crown on one of your teeth? And you wondered why they can't just fill it? Let's break down in today's video what dental crowns are, when to give a dental crown, which material is the best for a crown, along with some pros and cons of some materials. What is a dental crown? In simple words, it is a custom-made cap placed over a tooth, above the gum line, to restore its function, structure, and strength. When does a dentist advise a crown? The number one condition is a large cavity. When the cavity is large, too much of the natural tooth structure is lost, resulting in weakening of its strength and function. Large cavities are more prone to fracture over time if not properly restored. For a better seal, a crown is given, as filling may not seal properly, increasing the chances of secondary caries. The second option is a cracked tooth. A cracked tooth is already a weakened structure and is more prone to further fracture. Bonded restorations are not very durable and cannot withstand heavy pressure. Therefore, it is necessary to provide a proper restoration that holds the tooth together and prevents the crack from further spreading. The third condition is a root canal-treated tooth. But keep in mind that not every root canal-treated tooth needs a crown, but that's for another day's discussion. So why a crown on a treated tooth? RCT-treated teeth become more brittle because they lose their blood supply and hydration, and during RCT, decay, infection, and some natural tooth structure are removed. This makes the tooth weaker and less resistant to biting forces. Without a crown, they are prone to cracking or breaking under chewing forces. The fourth condition is worn-down teeth, like in patients with bruxism and eroded teeth. Worn teeth lose enamel and dentin, making them weak and prone to breaking down until they are of very little size, resulting in uneven height and occlusion. Therefore, a proper restoration is needed to restore function, structure, and appearance. However, an important consideration when restoring such teeth is the material of choice. Since the patient is already having occlusal forces that result in tooth wear, avoid using the material that is more prone to fracture under high occlusal forces. The materials will be discussed next. Cosmetic concern is our fifth condition. Some people have stained teeth that don't respond to whitening, a chipped or uneven tooth, or even small gaps. So crowns are needed to make the smile more beautiful and according to the patient's standard. However, crowns are not only the option for cosmetics, especially in the anterior region, veneers are also a very good option. So ask your dentist which is best for you. The last but not least condition is support for a dental bridge. A dental bridge is used to replace one or more missing teeth. It typically has pontics, commonly referred to as artificial teeth that replace missing ones, and abutments, which are the supporting teeth on either side. If you are having a missing tooth, a crown can act as part of a bridge when it is used as an abutment crown to support the replacement of a missing tooth, by preparing the two adjacent teeth and fitting them with crowns. Moving forward, towards the types of materials used for dental crowns, today, we will mainly discuss the pros and cons of each material. A full, detailed lecture on the properties of each material will be uploaded soon. First is a dental porcelain. It is a tooth-colored ceramic material widely used in dentistry for restorations. It closely mimics the appearance, translucency, and durability of natural enamel. It has excellent aesthetics with color stability. It is resistant to stains and wear. Despite its high aesthetics, it is not suitable for posterior teeth, as it is very brittle, can chip off easily. The next type is porcelain fused to metal, which is referred to as PFM. It is a type that combines metal for strength and porcelain for aesthetics. The inner layer is made of metal, and the outer layer is porcelain for aesthetics, mimicking the natural tooth color. It gives a good strength, just like a metal crowns, which provide excellent strength, but metal crowns are not commonly used now. It is suitable for both regions, but in the anterior zone, we have better material available for aesthetics. It is economical, and a patient can easily afford it. However, a metal can sometimes show as a dark line near the gum. It is not as translucent as all ceramic crowns, giving a slightly less natural look. It can cause wear on natural opposing teeth. The next type is dental zirconia. It is a high-strength ceramic and is considered one of the strongest and most aesthetic dental materials available today. It is stronger than porcelain, has better aesthetics, and is durable. But, it is more costly than porcelain, and is difficult to repair and adjust once cemented. The next type is a gold crown. These are used once widely, but not now, due to cost and aesthetics. The last is a resin crown, which works best as a temporary crown. It wears down easily. Now, what are the benefits of a dental crown? The main benefit is that it restores the patient's chewing function. It provides protection and strength to the weakened tooth structure. It improves aesthetics and helps in tooth alignment. The most asked question by patients is, how long does a crown last? With good care, crowns can last 10 to 15 years and sometimes even longer. Brushing, flossing, and avoiding poor functional habits like chewing on ice or grinding teeth can help extend their life. Like any other treatment, crowns have their own considerations. Some people feel sensitivity at first, which usually improves with time. They can chip or loosen, especially if you grind your teeth. A crown isn't just about appearance, but it's about protecting your tooth and keeping your smile strong for years to come. So if your dentist suggests one, it's because your tooth needs that extra protection. Thanks for watching. If you found this helpful, give this video a like, and don't forget to subscribe for more dental tips. Got a question about crowns? Leave it in the comments below, I'll be happy to answer. See you in next video.